Hello and welcome teachers. In this session, we are going to talk about autism spectrum disorder. The objective of this very session is to enlighten all the teachers about all the general aspects about ASD and how to identify various signs and symptoms in children with autism spectrum disorder. This will not only help you in ruling out children with autism, but also to motivate you on how you can bring a change in them. Now, if we see the definition of autism spectrum disorder given by Centers for Disease Control and Prevention, it is a developmental disability that can cause significant social, communication, and behavioral challenges. Autism is also known as a spectrum disorder, and it's also a heterogeneous disability because its symptoms and characteristics appear in a variety of combinations that affect children in different ways. So, why this developmental word is used? This means that the symptoms of ASD can be present since the very early years of life, and also it's a neurodevelopmental condition which majorly affects three areas of the child: social, communication, and behavior. It is also called as a spectrum disorder or a heterogeneous disorder because ASD comes with different and diverse symptoms which are present in different combinations in different children. Also, it has three different levels: mild, moderate, and severe. That is why majorly it is called a heterogeneous disability or a disorder. Now looking at the INCLEN diagnostic tool for autism, and its study states that the prevalence of ASD is 1 in 125 children ranging from 3 to 6 years of age and 1 in 85 children ranging from 6 to 9 years of age. This study was published in March 15, 2018. Teachers, prevalence rate means the proportion of persons or children in a population who have a particular disorder or a disability at a specified point in time. Now, let's have a look. What are the main three areas of problem or deficit in children with ASD? First, social communication. Second is social interaction. And third is behavior pattern. Teachers, now let's have a look on the first two criterias, that is social communication and social interaction. First symptom is delayed speech and language skills. So this means that sometimes the children with ASD may have an unclear or slurred speech, and also it's probable that the speech or language milestones they may achieve later as per their demarcated age. They also use very limited words in communicating their needs. Second symptom is flat, robotic speaking voice or sing-song voice. Generally, children with ASD have a greater tendency of imitating or repeating the voices which they generally hear on the television. On the other hand, some of them may speak in a very monotonous or a robotic fashion. Third is echolalia. It is like repeating the same phrase, like the word we say echo in English. For example, if you ask a child, "What's your name?" the child will simply repeat the sentence, "What's your name?" without even understanding the very basic meaning of the statement. Fourth is repetitive speech. For example, if a child wants to immediately go out for a walk, then he or she may say, "Mom, I want to go out." This particular statement can be repeated by the child numerous times depending on the current situation and also depending on the child's mood. Fifth is not using or rarely using common gestures. Generally, gestures are a part of the non-verbal communication in children and also in adults. Children with ASD deliberately fail in using any kind of nonverbal communication, and they are also not able to express their needs, their emotions or desires only through gestures, and they also fail to understand what the caregivers or the teacher or other age mates may mean through different gestures while speaking to them. Sixth, inability to stay on a topic when talking or answering questions. As a prime symptom or a sign, generally children with ASD fail to initiate any conversation with any stranger or with even their parents, and as a result of which they are also not able to stay at a particular topic, and they also fail to understand the instructions given by the other people. Seventh is they may not be able to respond to their name. For example, if I try calling a child by its name n number of times, still it's possible that the child will not even respond to your question nor to the instruction given to the child. Eighth, playing, sharing, or talking with other people will be a difficult task. Ninth, child will prefer to be alone. So teachers, these 2 points are very much in coordinates with each other, as we have seen in the initial slide, that generally children with ASD have a problem in social communication, and also they are not able to initiate any conversation with others. As a result, mostly they tend to stay alone. Neither they like any other age mates coming up to them and talking to them or playing with them, nor they are able to play, share, or talk with other people. 10th, they may avoid or reject physical contact or may ask for more. So, this is as a result of poor sensory integration that we see in children with ASD. Some of them may ask the parents for tight hugs, they may ask for more kisses or pecks on the cheeks, whereas on the other hand, some children with ASD may repel completely to those caregivers who wants to hug them. 11th, major problem in giving eye-to-eye contact. This symptom teachers being a major symptom in children with ASD. For example, if you try speaking to any child with autism, it may be possible that you are standing right in front of the child. Still, the child may simply look into space or may be staring at the corners of the room, but will deliberately fail to give or maintain any kind of eye-to-eye contact. But this particular symptom may slightly differ from child to child. 12th, doesn't understand or reciprocate to emotions. In our terms, we call it as emotional reciprocity. This means that the child himself or herself is unable to express the desires, needs, or their emotions, and also it's possible that, for example, a parent maybe is crying in front of them. Still, it's possible that the child may ignore the emotion completely or simply may start smiling or laughing without any reason. Teachers, let's now understand the signs and symptoms under the criteria of restricted and repetitive behavior. Till now, we studied about the symptoms under social communication and interaction as a major problematic area. Before we start with these signs and symptoms, you all need to understand the very basis of all these behaviors. That is, children with ASD have problem in the sensory integration, which means that the way our own sensory system or senses work, it is not the same in children with autism. Therefore, we see a very deviant and unnatural behavior pattern in these children. So, let us try and understand the symptoms one by one. First, lining up toys. We may see most of the objects or toys, especially these children, tend to display in a line manner which may have no meaning related to it. But visually, the children like to take that input for their body. This is the very reason they tend to do so. Second is flipping objects. It's possible, for example, a child may tear off a particular piece from any paper or simply pick up any random object or a toy and keep on moving that paper to and fro in any direction. This also helps them in taking the visual input which may not be possibly the input which they are getting normally in the daytime. Third, difficulties with transition. It also comes as a major sign and symptom when we talk about children with autism. Any kind of transition, any kind of shifting from one topic to another or from one situation or one location to another, this transition mostly becomes little difficult for any child with autism. It's possible that they may throw certain amount of temper tantrums. Fourth, strong attachment to or preoccupation with unusual objects. For example, a child may be so close with an inanimate object, basically which has no life. He or she may keep that object very close to him all through the day, even while the child is sleeping. Fifth, constant moving and hyper behavior. Certain symptoms, as teachers, we need to understand that it's common in almost every child. So, constantly moving and any hyperactive child, this symptom can be seen in other neurodevelopmental disorders as well. Therefore, it is also very common in most children with autism. They tend to have a lot of energy within them, and due to no proper channelization of the energy, they exhibit this tremendous amount of energy on random activities or tasks. Sixth, specific routines or fixations. For example, if a child, while going out of the house, maybe for a get together or maybe for a walk, it is quite possible that the child may tend to wear the left slipper first and then he may choose to wear the right slipper. Similarly, while wearing a shirt, he may prefer to put his left arm first, followed by the right arm. So, any kind of fixation is very much probable in seen in children with autism spectrum disorder, and any kind of change if we try to make in the routines, as a result the child may get really agitated or very aggressive. Seventh, extreme sensitivity to touch, light and sound. The very basis of this problem is that of poor sensory integration. For example, the amount of light which you want to read a book in may not be appropriate or enough for the child with autism. They may require more or brighter light, or another child with autism may want less amount of light to read that particular book. Similarly, some may respond to pain differently. One may be oversensitive to pain in terms of touch, and the other child with autism may have undersensitivity. Eighth, not taking part in make-believe play or imitating others' behavior. They won't be able to play Such games like teacher teacher or doctor doctor, or any game related to pretending, they may not have that understanding and imagination. Ninth, fussy eating habits. This is because of oromotor or oral sensitivity issues. Different tastes, very basic tastes, these children may not be able to eat or may become very fussy while eating them. Also, normal chewing and swallowing, they may not be able to do that very easily. 10th, lack of coordination and clumsiness. 11th, impulsiveness. These two again are very common in other neurodevelopmental disorders also. 12th, aggressive behavior both with self and others. Teachers, self-harm comes as a very major sign and symptom when we talk about autism spectrum disorder. So, as teachers and as parents and other caregivers, we have to be very careful in identifying if at all the child is agitated or aggressive, and we do not have to create such situations wherein the child should harm himself or herself or others. The last one is short attention span. This also comes as a very common symptom in most of the childhood disorders if we take care of this particular point in the very early years of life. I believe that in the later on years, attention, concentration, and memory will be really good even at all in children with autism and other children having any neurodevelopmental disorder. Teachers, now let's have a look on the different levels of ASD. First is mild level, second is moderate, and the last one is severe. So, when we talk about mild level of autism, there is slight difficulty in initiating social interactions or having a conversation with others. These children may also have a problem in organizing and planning issues. When we talk about moderate level, which overall requires sufficient and a substantial level of support by the teachers, parents and caregivers, we can also see these children have limited social interaction, narrowed special interest, and they mostly involve in certain repetitive behavior. Lastly, we will talk about severe level of autism spectrum disorder. In this, children definitely requires a lot of substantial support from the caregivers, and they mostly have a lot of verbal and non-verbal communication problem and also face a great difficulty in changing action and the focus. Now, we will talk about the role of teachers. Why all the teachers need to understand that what is expected out of them if they come across any child with any disability in the classroom. There are always some general duties which all the teachers and other caregivers need to follow in the school itself, which further will definitely help these children. We believe educators need to discover the potential in all students who have autism, and it is vitally important for teachers to be aware of how autism is for their children. So teachers, herein we really need to understand that each and every symptom and sign in children with autism is different from child to child. We have to be extremely careful, and minutely we need to observe all these symptoms in different children, and as a result we can never generalize all the symptoms or categorize it in one go. Third is the school environment needs to be designed in a way where it creates a secure environment that is best for learning. The fourth point is we need to create schools that are a place where all children can learn, grow, and evolve as extraordinary human beings. This means that as teachers, if we consciously or unconsciously restrict our viewpoint towards these children, or if we restrict the resources around them, then they won't be able to grow ever in their life. Also, we have to remember that we have to remove the terminology disability and change it to difference or uniqueness like differently abled. This is a very important point for all the teachers and caregivers because the moment we ever say this word disability, we are unconsciously categorizing the children into those someone who are disabled and who can't do anything for themselves. So we have to make ourselves very much enlightened in the way we really need to change and substitute the word disability with something very unique or differently able. Next is we need to evolve to a holistic approach wherein discovering each child and creating an individual learning program based on their specific talents is very important. Individualized education plan, which in short we call as IEP, is extremely important for any child with any disorder. This will consist of different goals, long and short-term goals for different child. No two goals or no two IEPs of children can be the same. Lastly, we must use technology in a more effective way so that all children have opportunities to achieve success. Teachers, let's end this session with a beautiful quote. All kids need is a little help, a little hope, and somebody who believes in them. So, teachers, it's a request that please believe in yourselves so that you can surely and definitely believe in all your children so that they grow and evolve definitely as extraordinary human beings.